Hi, my name is Rebecca, and I'm covering the genetic and chromosomal disorders over Chapter 3, Prenatal Development and Birth. The different disorders appear to be transmitted through dominant recessive genes. Autosomal disorders are caused by genes located on the chromosomes. Sex-linked disorders are found on the X chromosomes and are more likely to affect males than females. They are caused by recessive genes and are found in infancy, and dominant genes are usually found in adulthood. Phenylketonuria, or PKU, is a recessive disorder that causes a baby to have problems digesting the amino acid phenylalanine. PKU happens when there is a defect in the gene that helps create the enzyme. Without the enzyme, a dangerous buildup can happen when they eat foods that contain protein or eats aspartame, which is an artificial sweetener. There are many symptoms, which include a musty odor in the breath, skin, or urine, neurological disorders or seizures, microcephaly, and intellectual disability. If severe enough, it can cause severe brain damage. In less severe cases, there is a smaller risk of significant brain damage. It is also found on the chromosome 12 and is usually a recessive inheritance off of an unaffected carrier and an affected carrier. Sickle cell or sickle cell anemia is caused by the deformity of the normal red blood cell. A normal red blood cell is circular and smooth, as a sickle cell is crescent-shaped and sticky. It is caused that it is said to have caused that they um, clot blood in the blood vessels and cause severe pain. It also causes oxygen not to be reached to an area that is needed, and it has the symptoms that are included of severe pain, swelling of the hands and feet, swelling of the abdomen, fever, pale skin, jaundice. It is caused by a mutation of the gene that tells your body to make hemoglobin or healthy red blood cells. Complications are stroke, acute chest syndrome, pulmonary hypertension, organ damage, blindness, leg ulcers, and many others. Tay-Sachs disease is that every 1 in 3,000 babies born to Jewish couples in Eastern European descent have this disorder. By the time the baby is 1 to 2 years old, they are likely to suffer from severe intellectual disability and blindness. Very few survive past 3. It is caused by neuron degeneration, and that is the intellectual disabilities. It also can cause other problems. It causes the brain to die very, very quickly, as the neurons can't fire and the body can't understand what the brain wants the body to do. Huntington's disease is a very aggressive and devastating disorder that causes the brain to deteriorate and affects both psychological and motor functions, almost like multiple sclerosis, which is also MS. They recently found a test to identify the Huntington's gene, but before they didn't have that, and it was either you would get sick or you didn't get sick to know for sure if you had that disorder or gene. Hemophilia is a very serious sex-linked recessive disorder that cause the blood of the affected person to lack the chemical component that causes blood to clot accordingly. If there was a huge trauma and somebody is bleeding very, very quickly and a lot of blood is happening, they aren't going to clot, and they need intervention to stop the bleeding as quickly as possible. Otherwise, they will die no matter how much blood is substituted for the blood that is lost, they will still continue to bleed out. This disease is most common in males, and 1 in 5,000 baby boys are born with this disorder. A variety of problems can happen with a child that has too many or too few chromosomes, which is chromosomal error or chromosomal anomalies. Sex chromosome anomalies are another type of chromosomal anomalies in childbearing women. Trisomy 21 is also known as Down syndrome. It is caused that the child 3 copies of chromosome 21, roughly 1 in 800 infants are born with this anomaly. Women over the age of 35, specifically 35 to 39, the risk is about 1 in 270 births. Those over 45 have the risk of 1 in 50 births having trisomy 21. Klinefelter disease or Klinefelter syndrome. The men that have this disease look like any other peer, but they have underdeveloped testes and very low sperm production as adults. Many have speech and learning disabilities. During puberty, these boys experience both male and female changes, such as their penises enlarge and breasts develop. Turner syndrome only affects women. These women are anatomically female but show stunted growth. They also have a high risk of having malformations of internal organs, such as the heart and kidneys. Without hormone therapy, they do not menstruate or develop breasts. Only 10% experience normal puberty and have little to no difficulty conceiving and having children. Others that have this disorder can achieve successful pregnancies with donor ova. And these are my citations from the Mayo Clinic and also the Lifespan Development 8th edition. Thank you for coming to my presentation. I hope you enjoyed it.